Hi, I'm Dr. Chen, and I'm a pediatric oncologist at the Sidney Kimmel Cancer Center and Johns Hopkins Bloomberg Children's Center. My research interests lie in soft tissue sarcomas, specifically rhabdomyosarcomas, which is the most common soft tissue sarcoma of childhood. There are two types, embryonal and alveolar. Embryonal occurs mainly in young children, and alveolar occurs in adolescents and young adults. Over the past 4 decades, there really has not been much change in treatment of these cancers. The mainstay consists of surgery, radiation, chemotherapy. Despite the technological improvements we've made with radiation and surgery, the survival outcomes for high-risk patients and relapsed patients is still very poor. There is really a dire need for new treatment options. My research interest focuses on immunotherapies and how to translate them to pediatric sarcomas. There has been a lot of success with immunotherapy in the adult realm. There's been so much progress made with checkpoint inhibitors in melanoma and renal cell carcinoma in the treatment of adult cancers, but we haven't been able to translate the success to pediatric sarcomas. My hypothesis is that there is an immunosuppressive environment in the pediatric soft tissue sarcomas that is not allowing the immune system to recognize the tumor as foreign and attack. So in order to try to solve this problem, I am investigating what is the immune system in the tumor microenvironment. So what are the immune cell players that thrive in the tumor, and how do they interact with the tumor cells themselves? With the help of the Pediatric Cancer Research Foundation, I have been able to continue my work in studying the tumor microenvironment of rhabdomyosarcomas. Over the last year, I've discovered that rhabdomyosarcomas are not immune deserts, but they're actually infiltrated with lymphocytes and myeloid cells. And it's quite interesting because the myeloid compartment seems to predominate the tumor, and much literature is showing that the myeloid compartment is a very immunosuppressive presence, and it tends to release chemicals called cytokines that can suppress immune response, and it can also stimulate the growth of vasculature and promote tumor angiogenesis, which allows the tumor to grow further. In addition to the predominant myeloid compartment, I've also found that the lymphocytes aren't diffusely distributed in these tumors. Instead, they actually form tertiary lymphoid structures. So there are T cells and B cells, and they appear to be clustered together, and they are found near the vasculature and not just any random place in the tumor. So my hypothesis is that the myeloid compartment is causing an immunosuppressive effect and inhibiting the lymphocytes from leaving the tertiary lymphoid structures and really preventing effector T cell function and preventing T cells from being activated. So what I hope to discover is, are there things that we can target in the tertiary lymphoid structures or in the myeloid cells that can stop this immunosuppression and allow us to stimulate the T cells with either a checkpoint inhibitor? And there are several types that we can use in combination that may improve immunotherapy response to rhabdomyosarcomas. So there is a lot of work to be done, and I am so excited, and I really thank the Pediatric Cancer Research Foundation for supporting my research and trying to continue to find better and less toxic cures for the treatment of pediatric rhabdomyosarcoma.